Good morning, everybody. My name is Gideon Orbach. I practice chiropractic here at the World of Wellness. Used to be the Weiner Wellness Center, and before that, it was the Pain Release Center. Constantly upgrading our facilities, constantly bringing in new product, bringing in new ideas, bringing in new people, having a name to change, construction project here. But ultimately, we're doing the same thing as we've done since I got started with Dr. Weiner more than 14 years ago, which is just doing everything we know how to do to take the best care possible of our patient population and the people who decide to jump into our little natural health pond here. Besides being a chiropractor, I recently finished up my primary spinal practitioner certification at the University of Pittsburgh. There are really only a very large handful of chiropractors across the country who have this designation, and it's the first program of its kind that was open to both chiropractors and physical therapists. So I'm pretty excited about that, and I'm also pretty excited to be able to tell you that just this past week, I've officially had my 20-year anniversary in practice. Hardly a lifetime, but long enough to have. All right, hardly a lifetime, but long enough to have learned a few things if you're not asleep at the wheel. So anyhow, what we deal with here is health, good health. And in order to talk about health, we have to have a working definition of what health might be. And in a pre-COVID world, we had a packed house, and we'd have open for discussion. And I'll ask the crowd, what does it mean to you to be healthy? What's your working definition of the word health? So if you want to type in the margins and join in the participation and ask any questions or fire away any comments at any time, always welcome. I got one already. Technology Grandmaster and Guru Phil is hosting. So if there's anything that you want to cut across while I'm having this presentation, please feel free to join. But anyway, my definition of the word health means having the ability to recognize, interact with, adapt to, and overcome your environment, both internally and externally. So our internal environment, that's our body chemistry. That's what we eat, the nutritional supplements that we take, what we consume, how it affects us, how our organ systems communicate with one another, how our nervous system, our brain and spinal cord communicate with all of our organ systems. That's our internal health, or our internal environment, I should say. Our external environment is, that's you. You are my external environment. Whatever it is that's going on around me that I need to be cognizant of, that's my external environment. I'm part of your external environment right now. So having the ability to recognize, interact with, adapt to, and overcome those two environments internally and externally, to me, that's what it means to have the quality of possessing good health. Now, I suffer a very good problem. I've somehow become kind of popular, and I have a full schedule of patients, and normally we have these open houses, and I do, if not 2, maybe even 3 presentations and host workshops and join other people. But this time around, this might be the only time you get to see me, so I'm going to try and cram everything I got into one workshop. So we're going to talk about a number of different things that used to make up their own time frame. So the first thing we have to do is I got to explain to you what it is that I do here. I practice chiropractic. That means in my world of chiropractic, I make adjustments and manipulations to people's joints, the joints of their spine and their extremities, and to their muscles. I do a lot of trigger point release and a lot of active stretching with my patients. I recommend condition-specific and appropriate nutritional supplementation, and I occasionally teach condition-specific low-tech rehab exercises in order to reinforce the mechanical treatments that I do. Now, by low-tech, what I mean is you don't need equipment. Most sophisticated pieces of equipment I might ask somebody to use are a shower towel, maybe a soup can. If you have exercise equipment at home, we can talk about it, but I'm not sending anybody off for an expensive gym membership or to buy expensive, fancy equipment. We're looking at ways to move your body that could be more advantageous for you to accelerate your healing. We got to talk about pain. Definition of the word pain. Pain is an individual, emotional, subjective response to noxious stimuli. So what that means is, first of all, individual, subjective. So what I consider to be painful to me and what you consider to be painful to you and what somebody else considers to be painful to them could be three different things. We all have our own individual variances of what a pain tolerance is. Our pain tolerance is it's uniquely ours. And to have a really high threshold where it takes a lot of stimulus to cause somebody pain, they have what we would characterize as a good pain tolerance, that might not necessarily be a good thing. That might mean there might be something really bad going on that's brewing internally that is going unrecognized and unaddressed and untreated until it gets out of hand. Other people, every little thing might bother them, and they might apologize because they whine too much. They might feel like it's a sign of weakness, but then again, they might go and seek out treatment before they start to develop serious problems. So if pain is an individual, emotional, subjective response, if it's emotional, that means where would it be found? It's probably somewhere in your head, in your brain. I know that I've had this conversation quite a few times with patients who said to me, my neurologist or my PCP or my whoever told me that my pain is all in my head. And they were kind of aggravated because they interpreted that to mean that somebody was being dismissive of them. But really, that is the truest statement we can make, because pain is a function of how your brain and your body are communicating with each other, and how your brain is interpreting the signals that your body is sending, and what your brain is going to do with those signals. So if you want to effectively treat pain, what you really have to do is learn how to disrupt messages from the body to the brain and from the brain back to the body, and restore those messages from some sort of a noxious, painful, harmful, undesirable type of message, to shifting it over to something that feels good, that we break up that cycle, that chemical cycle. So we can talk about pain as being caused by emotional, chemical, I mean, that's what you eat, the supplements that you take or don't take, as the case may be. And we can talk about pain in the context of body injury, of body tissue being twisted or torqued or pulled or sprained or strained in an inappropriate direction that starts signaling the nervous system and signals the brain that there's a problem. And that's where I live. I like to do physical things. I like to do hands-on treatment and exercises primarily to start to disrupt those cycles. So far, so good, Phil? Questions, comments, moral outrages? Good. So let's talk about a little bit more evidence to support the statement that your pain is in your head. During the Civil War, soldiers were injured and they had legs and arms amputated in battlefield hospitals. And we can only imagine how unsophisticated those conditions are relative to today's very high-tech medical procedures. And then patients, soldiers, would report having pain in body parts that no longer exist. A leg had been amputated, and the patient still feels pain in a leg that isn't even there. So that's where we get the term phantom pain, and that's a form of neurologic, brain-based, in-your-head pain, and that's exactly the kind of stuff that we want to disrupt, the cycles that we want to interrupt. We want to teach strategies to make sure that that doesn't occur in our wellness center. Okay, so once we've established all of that, let me explain in a little bit more detail about what it is that I do and how I treat my patients. If you could imagine a string of dental floss, and we tie a knot in that dental floss, and we slip it into the bottom two front teeth, and then somebody standing halfway across the room will pull on the dental floss. So I have a piece of string locked behind my teeth right here, and somebody sitting across from me is grabbing it, and they're pulling tug of war against me. Now what happens is these very small muscles here at my temples and in the lateral, the side aspects of my face, just above my jaw, the temporalis, the masseter, those muscles are very, very strong and very thick and very dense when it comes to chewing. Anybody that chews gum or has chewed a tough piece of steak knows how strong they can clench their jaw together. But they're not designed to pull tug of war and to keep you from pulling my chin forward on this plane and to pull retraction and bring my chin back. So what happens is that group of muscle is going to fatigue and they're going to spasm and they're going to become irritated and they're going to start to send chemical messages into the nervous system signaling that pain phenomenon. In turn, I'm going to start to lose range of motion at the hinge of my jaw. More chemical signaling is going to build up, and I'm going to experience pain. So how do we fix it? We got to do three things. We got to do appropriate nutritional supplementation to get rid of the chemistry, the painful stimulus chemicals that build up, that come along with tight spasm muscles, that come along with loss of range of motion and irritation. We solve chemical problems with chemistry. We use anti-inflammatories. We use minerals to relax the tight muscles. We have one workshop after another all week long talking about individual products and chemical processes that go along with the body. So I'm going to just briefly glaze over that one and talk about fish oil, turmeric, X-flame, inflammaric. We have ample nutritional supplementation to reduce inflammation. We got to get the jaw to come out of spasm. We got to get those temporalis muscles, the masseter muscle. We got to stretch them and maneuver them and get them to restore back to their normal state of tone and their normal state of length in order to regain our ability to chew and open and close our mouths in a comfortable way. The third thing that has to happen is somebody has to quit pulling on the dental floss. Otherwise, we're doing the exact same thing over and over again. Now, muscles, tendons, and skeleton behave the exact same way. A muscle or a group of muscles or an action of muscles will spasm, or they're going to tighten, or they're going to pull in a direction that's disadvantageous for us. Those muscles all attach to tendons, and the tendons are like the dental floss. They're a fixed length. Now, the tendons on the other end attach to the skeleton, to a bone. And when we pull hard enough on those tendons, the bones start to lose their range of motion and the joints don't flex and extend or rotate or open and close the way that they're designed to. Now, why is that so important? Inside of every single joint of your body, in the joint spaces where two bones come together, whether we're talking about the hinge of the jaw or any of the spinal joints or the joints of the bones of your feet, we have very specialized, sensitive neurological tissue. That neurological tissue, they're called pressure-sensitive joint mechanoreceptors. So when a joint, where two bones come together, we have a joint, is moving through its full range of motion at full capacity, what happens is those joint mechanoreceptors are allowed to signal into the nervous system, eventually to the spinal cord, into the brain, where are we in space? And the brain doesn't have to work to localize the body. So when we're doing chiropractic adjustments, what we're in essence doing is moving joints through their complete ranges of motion, allowing those pressure-sensitive joint mechanoreceptors to fire the way that they're supposed to send input into the central nervous system that will allow us to find our position in space, for one, to be able to have better ranges of motion, to have the brain divert more neurological output to other body functions, such as our immune system, such as our cardiovascular system, such as our digestive system, and divert attention away from the chore, the hard work of finding our body's position. So we literally decrease our threat to fall. We decrease the threat that we're going to trip and fall over our own feet or stumble, and our balance improves. and we generally start to feel more comfortable living in our own bodies. So what we talked about just a minute or two ago was how pain is all in your head, and how there's this communication from the body telling our nervous system, telling our brain, you can interpret this as a painful phenomenon. Now it's time to start hurting. And now we as a population are going to look for a way to shut that off. So if our brains are firing at a higher threshold for everything else, because our position in space is well localized through that movement at the joint mechanoreceptors, and those pressure sensitive neurological tissues are allowed to do what they're supposed to do, now our brain does a much better job of suppressing our pain, whether that pain comes from physical matter, or whether it comes from a chemical phenomenon, or whether it comes from a nutrition deficit, or even the wrong nutrition, or an emotional source. So far, so good, Phil? Good. Good. So what are we going to do to make our bodies more mobile, more supple, allowing those ranges of motion at the joints to occur, allowing our nervous system to function at the way it was designed to, taking workload off of our unnecessary workload off of our brains, and allowing our brains to govern the rest of the body with one less thing to worry about? Well, I want you to do this. I want you to think about your body as being a giant antenna. We're constantly receiving information from our environment, our external environment, and we're transmitting that information into ourselves. We're receiving that information and transmitting it into our brains. So if you want to have a high functioning antenna, it has to have the ability to vibrate. It has to have the ability to move freely. So for one, that's where the combination of chiropractic adjustments and muscle therapy techniques come into play. For two, we have to do something for ourselves to make our antenna as efficient and as effective as possible. So the first thing we want to worry about is we want to concern ourselves with is our posture. If we have better posture, we're literally going to line our joints up better. We're going to line our skeleton up better. So we're going to be able to distribute and disperse our body weight, even through movement, where it's designed to be held, rather than taxing joints and taxing muscles and taxing weight-bearing structures in a way that they're just simply not designed for. So let's talk about posture for a moment, and let's call this exercise number one. Now, at the very beginning, I told you one of the things I like to do is I like to teach patients specific exercises that will help accelerate the healing of the condition that they have. If you want to go to the gym, I'll help you find a good trainer who's appropriate for your needs. It would be wonderful. I'd like to steer 100% of my patients to go work out at the gym with a trainer who's helping them with their individual needs, but that's not realistic. Not everybody has the time for that, and not everybody has the desire for that. So let's talk about the things that you can do at home, at work, in the car, for yourself. And number one issue is we're going to talk about good posture, and you'll see why this is so important in a minute. So what I'm going to do is I have a couple of cues that I like to think about. In my upper body, I'm going to think about the area that my belt buckle to the bottom of my sternum, my breastbone. At the bottom, there's a very sensitive piece of cartilage called the xiphoid process, the solar plexus. And so I have this region where I have top of my belt buckle to my xiphoid process, and we're going to generally refer to that as the abdomen. And what I want to really focus on being is tall in my abdomen. So I'm going to stretch this area. I'm going to create as much separation between these two parts as possible. And I'm thinking about being long and tall in my abdomen. The second thing I'm going to do is I'm going to take my shoulders and I'm just going to throw them back. So when I'm sitting here with my shoulders thrown back, I'm thinking about my shoulder blades, my wing bones in my back. The little points at the bottom are being shrugged downwards. I'm not going to shrug my shoulders up here. I'm shrugging them down. And when I do that, they squeeze together just a tiny, tiny little bit, and I'm trying to touch my shoulder blades to my belt. Obviously, that's not going to happen, but that's my visualization. The next thing that's going to happen is I want to imagine a little string coming down from the ceiling, and it's going to be attached to the tallest point at the top of my head, and the ceiling string is going to hold my head up. So I'm sitting here very comfortably with my shoulders back, my abdomen is tall, and my head is up. So if you think about those three cues, your torso will be in very good posture. As I sit here, now that I'm not slumped, and we're going to talk about the importance of that shortly, I feel like my weight has distributed fairly equally from side to side, and I feel like I'm very well balanced in my chair. You can do the same exact thing standing up. If you could imagine taking two bathroom scales, putting them right next to each other and putting one foot on one scale, another foot on the other scale, if you're a 200-pound person, you probably won't see exactly 100 pounds on one side and 100 pounds on the other side. You probably see closer to a 90 to 110 mix. But if you stand on those two scales and you go long in your torso, shoulders back, head up, your body will behave reflexively. That means it's something you don't really have a control over voluntarily. It will shift you much closer to that 100-pound side-to-side symmetry. So we're sitting here in our best possible posture. Now, we can talk all day about all the nutritional supplements and all the anti-inflammatories and the neurological boosters and the muscle relaxants and the medications that people might be on, and we hope that we can help them come off of, and we can talk about all of that stuff. But I'm here to tell you the most important thing you're going to put into your body is oxygen. We want to be deep breathers. So let's try this. We're sitting here in our ideal posture, being long in the abdomen, shoulders are thrown back, head is up. And in this position, I want everybody to inhale as deeply as possible through their noses, and we're not going to break the posture that we're in. So as I inhale through my nose, you're going to see very, very little movement in my shoulders. Now I'm going to blow out. And I'm going to inhale through my nose. And if you think I'm going to be able to get more air in by shrugging my shoulders up, and I'm this breather, guess again, we want to use our diaphragms. So what we're going to do is we're going to keep those shoulders in that locked back position. Inhale through your nose. Feel your abdomen is long and tall, and it's expanding full of air, and I'm going to blow out through my mouth. Let's do that again. Big deep breath in through your nose. Shoulders aren't going anywhere. Abdomen is expanding full of oxygen, and blow out through your mouth. Now you can see that my torso is certainly moving, but it's not moving much. So I'm going to inhale once again through my nose. Hold some more, and blow out through your mouth. Now, once upon a time, as I said, we would do these, well, we're starting to do these presentations live. I mean, there are certainly people in the building, but we'd have a crowded room, and we'd kind of go around the room and survey the crowd and talk about people who did shrug their shoulders up and explain to them what they're doing and why that's not appropriate for maximum respiration or maximum breathing. Some people would comment that they feel lightheaded after taking 3 or 4 deep breaths. That has to do with, one, you're using muscles to breathe that you're just simply not using. 2, your body temperature is changing while you're taking these deep breaths. Some people would tell me how relaxed they are, or that just even after 2 or 3 deep breaths, they start to feel like their bodies are relaxing, and they're feeling like they just woke up from a nap. And that's a very healthy, good phenomenon to experience. And some people would say how much more alert they started to feel, which is another very good experience to have. So regardless of the condition that we're working on, if you come to see me because you have jaw pain or a sprained ankle, or just you feel tight in your back, for whatever reason you might decide to come and see me, as we work on your condition, as we do manipulations and adjustment and muscle work and joint work to reset the mechanics of how your brain and your body talk to each other through activating those pressure sensitive joint mechanoreceptors, by letting go of the tension on the dental floss, by moving the jaw through its full ranges of motion. And you think to yourself, now's the time I'm going to ask, what are the most important, what are the exercises I can do to reinforce this? The first two exercises for all painful conditions: one is work on your posture. Two, work on your deep breathing. So let's just run through this very quickly one more time. I'm tall in my torso. I'm being long here. My shoulders are back. My head is up like it's being suspended from a string on the ceiling. Now I'm going to take a big deep breath in through my nose. You can see my torso starting to expand just a little bit, but I'm certainly not shrugging upwards. So my torso is expanded as I inhale through my nose. I'm holding 1,001, 1,002, and blow out through your mouths. Good. Again, one more deep breath in through your nose. Holding, hold some more, and out through your mouths. Now, one of the places, well, posture is important everywhere, but one of the places we want to talk about where good posture has to exist is when you're working, when you're at a desk. Now, this is a whole workshop in and of itself, and we're, like I said, we're going to combine everything into one. So I want to get very briefly into workstation posture, home workstations, and some things that everybody can be on the lookout for. Now, when the lockdown hit in last year in 2020, and people who had once upon a time worked in office settings were all told to work from home, we had a whole group of people who they didn't know what to do. They didn't know how to set up a workstation. They didn't know what was appropriate or how to make themselves comfortable at their work at home. So we did a few workshops about that. The first thing I want to suggest is how important it is to do, if you have a stand-up desk, that would be ideal, or a sit-stand desk, so that you're not sitting in the same place for all those hours over and over, for the repetition of just being still, especially if you're not in the kind of postural position that we talked about a few minutes ago. When you sit, depending on how good your posture is and how well you have your weight dispersed from side to side, you're going to increase the load on your spinal discs from anywhere from 40 to 90%. So when we talk about the economy of back pain, and it's an economy, all right. I mean, you think about all the surgeries that are performed, some unnecessarily so. You think about trips to see the chiropractor. You think about going for expensive rehabilitation. You think about loss of productivity. The economy of back pain is a billion-dollar industry. So what we want to do is make sure we're following good postural rules, and anywhere we can do our work standing rather than sitting, let's do it. When we do slouch and you find yourself in here, let's just, I don't like to practice mistakes. I don't like to reinforce bad habits, but let's just think about this sitting posture at the desk where people are slumped over, and imagine taking a deep breath in this position. If I breathe in through my nose and I'm slumped down and I'm holding it and I blow out through my mouth, it's barely a fraction of the amount of deep breathing I can do when I'm sitting up straight. So let's add this breathing exercise into the daily routine. And if you think about what you do all day long, whether you're sitting at a desk, whether you're in the kitchen, whether you are practicing chiropractic, whether you are an emergency room physician, let's think about taking little breathing breaks throughout the day. What I'd really like to do is I'd like to encourage everybody to take a break, to take 3 to 5 deep breaths, which should take you less than a minute, and to do that a minimum of 5 times a day. So if you're a home worker, if you're a workstation in my house person, should be very easy for you to just, nobody's looking, nobody's monitoring you. It's not a long break. We're just going to sit straight up and we're going to breathe deeply in a slow and relaxed pace. And from my perspective as a clinician, the single most common condition that people come to see me for are what's called a hiatal hernia. The hiatal hernia is a little place where the diaphragm muscle, which sits at the top of that abdominal section that we made long in this exercise, there's a little hole in the diaphragm muscle where your esophagus, which comes down through the back of your mouth, it passes by your heart and lungs. It pierces through a hole in the diaphragm called a hiatus. And then just below the hiatus of the diaphragm, we have a small ring-like muscle called the lower esophageal sphincter. And then that same tube beneath the lower esophageal sphincter changes names and it's called the stomach. So the stomach is a bag full of acid which churns or vibrates. And that acid, or that stomach, because it's churning and it's vibrating and it's moving, it has the ability to drift upwards and it can get itself caught in that lower esophageal sphincter muscle or even in the hiatus of the diaphragm, and it's called a hiatal hernia. That leads to difficulty swallowing, a metallic taste in the mouth, acid burning washing up into the esophagus, creating what's called heartburn. It leads to the feeling of being nauseous or regurgitation. And that's the single most common condition that I see patients for. And when you think about the mechanics of the stomach and the mechanics of the digestive tract and where these structures live relative to the diaphragm muscle, if you're slouching and if you're leaning into yourself this way, you're certainly creating a compression and you're going to create a competition for space. And that leads the stomach to just move out of the way, to surrender its position to other internal digestive organs, leading to that hiatal hernia condition and the symptoms that I described. So if you're sitting at home listening to me and you have the sensation of heat burning in your chest, that's referred to heartburn, you feel the acid washing up into your mouth, creating that metallic taste, you feel that place where your esophagus is starting to bunch up or to bend or to kink, and I swallow my pills or my food gets caught right about here. There are things that we can do for you mechanically. So shameless plug, come see me or my colleague, Dr. Phil. We treat hiatal hernias through mechanical adjustments frequently, very frequently. So if we're at our workstation and we have our standing desk and we're occasionally sitting and doing most of our work standing, we're going to be in pretty good shape. And if you don't have that kind of a setup and you're looking for a good ergonomic chair, let's position this accordingly. We have to make sure that our monitors are at about eye level. And we certainly don't want to have a light source that bounces off of the monitor or hits us in the eye or creates a blurred vision or creates that illusion on the monitor. So we want to position our monitors at the appropriate height, and we want to position our light source in a way that our room is going to be bright, our room is going to be well lit up, but it's not going to create a glare. And once we're in our sitting position in our monitor, we want to think about having the 90-degree rule. So our feet and our shins are going to be 90 degrees, feet flat on the ground, and the tibia bone, the bone of your shin, is going to be perpendicular to your foot. So we have 90-degree number one. 90-degree number two is going to be at your knees. So our thighs are going to be 90 degrees to our shins. Then our hips and waist are going to be 90 degrees to our thighs. And our elbows are going to be at 90 degrees to our body, so we can type with this 90-degree angle as well. So if we have our monitor set, we're sitting up straight and in good posture. We are our joints are bent at the appropriate angles. We're going to be in pretty good shape overall, and As I said, 40 to 90% increased load on your discs, on your spinal discs when you're sitting versus when you're standing. So at the very least, we're going to be closer to that 40 end than the 90 end. I'm drinking the Pro Reds. Shameless plug for Pro Reds. They're an antioxidant, and they help to keep your throat from getting parched when you're talking as much as I am. I'm not used to this. So anyhow, we've combined a lot of things in this time so far. And as I told you, I'm interested in physical things. I'm interested in mechanical things that we can do for ourselves. And one of the modalities that I've been starting to use more and more with my patients and teach it a little bit is what's called emotional freedom technique. And we talked about pain at the very beginning, as pain can be caused by physical means. If you roll your ankle, or if you bite into something so hard and you strain the musculature of your jaw, if you turn your head so far when you're merging in traffic or parallel parking that you strain your neck, or maybe you work out a little bit too vigorously at the gym, or after the turkey bowl for Thanksgiving Day family football evolved from a little bit of toss the football around to a little bit of tackle football. We talk about physical pain, body tissue, and what can I do physically to help you. We have to acknowledge that a lot of pain is caused by emotional factors and by anxiety, especially as the way the world is turning these days. So this emotional freedom technique was, it's based on acupuncture points. And it was, I don't want to say it was discovered, because acupuncture is thousands and thousands of years ago old, but it became popularized by a psychologist named Roger Callahan, who was working with Vietnam combat vets. Now, this was all done in the 1970s, before the diagnosis of post-traumatic stress disorder, PTSD, became a real thing. I mean, it was always a real thing, but it was never a known diagnosis until more recently after this. So Dr. Callahan is working with these guys who came home from combat, who have become detached and who are having a difficult time reassimilating back into their communities, who have what we now call flashbacks, and who are starting to suffer these neurological problems, and their bodies are all in pain after coming home from the war, without necessarily having targeted specific blunt traumatic injuries. So Dr. Callahan is one of these guys who he reads a lot and studies everything he can get his hands on, and he's just naturally a curious guy. And he discovers this emotional freedom technique that had been practiced based on acupuncture points, and he decides that he wants to try this with his support group that he's working with. And why not? Nothing's worked so far. This isn't going to be reliant on new medication. It's not relying on fancy equipment. As I told you, I like low-tech stuff. I like the way we move our bodies, the equipment that we have lying around. We don't depend on expensive paraphernalia. So what Dr. Callahan did was he taught these gentlemen a series of body points where they're going to tap, literally using their index and middle finger to tap on specific acupuncture points on their bodies. And the acupuncture point is so small and the fingertips are so big, relatively speaking, that even if you're just in the ballpark of the right point, you're going to get it. So what we're going to do is we're going to work on this this cycle of tapping. And the way it works is you have to have a mantra, a specific statement that you're going to make as you tap along. And so that statement has to be individual specific. And if you're really further curious about this and you want to talk to me, come schedule an appointment. We're starting to do more and more workshops here. We'll help you formulate something that works for you. But instead of working on a very specific individual mantra, we're just going to simply say, I believe in me. So what I'm going to do is we're going to run through this together, and I'm going to use my right hand to tap on the left side of my body. And the first thing I'm going to do is this spot, this fleshy spot on the side of my palm. If I were going to break a board, if I were going to do a karate chop, where would I want to make impact with that board? Where do I stand the best chance of breaking that board? That's where I'm going to tap. So I'm just going to use my right index and middle finger, and I'm going to tap on that fleshy spot, my board breaking spot on my left-hand side. And I'm just going to say, I believe in me. I believe in me. I believe in me. And I'm going to follow my own advice and sit here in that posture that we talked about. I believe in me. I believe in me. And now I'm going to make a shift, and I'm going to come up to the top of my head. If I were at the doctor's office and they're going to measure my height, and I want to be as tall as I possibly can, and I'm going to stretch myself up so the highest point on my head is going to touch the little arm where it comes out of the scale, that's where I'm going to tap. And I'm just going to keep tapping here. And I'm going to say, I believe in me. I believe in me. I believe in me. I believe in me. Now what I'm going to do is I'm going to come over to the inside of my eyebrow, right where it meets my nose. And I'm going to tap on that spot. And I'm going to keep saying, I believe in me. 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 Now I'm going to come across to where my eyebrow ends. I have my eye socket, which is like a bony ring. So I'm going to be just in that fleshy spot on the outside of my eye socket. And I'm going to keep tapping, and I'm going to say, I believe in me. I believe in me. I believe in me. I believe in me. And now I'm going to rotate down to the 6 o'clock position. So I'm just, once again, using that eye socket as a point of reference, and I'm in that fleshy spot right underneath the socket. And I'm going to keep tapping, and I believe in me. I believe in me. I believe in me. I believe in me. Now, right here in this seam in between the right and left side of where my mustache would be, I'm going to tap right into that place. I believe in me. I believe in me. I believe in me. I believe in me. Now we're going to come straight down, and I have this sort of this groove right below my bottom lip. I'm going to come to the middle of that groove, and I'm going to tap, and I'm going to do the same thing. I'm going to keep tapping, and I'm going to say 4 or 5 times, I believe in me. I believe in me. I believe in me. I believe in me. Now we're going to move to the next spot, and my collarbone, this bone right here at my collar, where I'm going to knock my microphone off. Sorry, Phil, technology wizard Phil. So I'm going to be on the inside of my collarbone where it meets my sternum. There's a little fleshy spot there too, that joint space. And I'm just going to keep tapping. And I'm going to say, I believe in me. I believe in me. I believe in me. I believe in me. Now I'm going to drop straight down my sternum till it comes to an end. And I feel my rib makes an arch. And I'm going to keep following that arch at the bottom of my rib to about my midline on the side. And I'm going to keep tapping right there. I believe in me. I believe in me. I believe in me. I believe in me. Now I'm going to move toward my thumbnail, my left thumb. If I put my fingers together, this is the part of my thumbnail that's furthest away from my index finger. So that's where I'm going to tap. And I'm going to keep tapping on that it's called the lateral aspect of the thumbnail. And I'm going to tap. I'm going to say, I believe in me. I believe in me. I believe in me. I believe in me. Now we're going to move to that same part of the index finger further away from the middle finger. I'm going to tap, say, I believe in me. I believe in me. I believe in me. I believe in me. I'm going to do the same thing on the middle finger, the part closer to the index finger, further from the ring finger. Keep tapping. I believe in me. I believe in me. I believe in me. I believe in me. We're going to skip the ring finger, and we're going to move to the 5th finger, the baby finger. And we're going to tap on that part that's closer to the ring finger, further away from empty space over here. I believe in me. I believe in me. I believe in me. I believe in me. Now we're going to move to the fleshy muscular spot in between the 5th finger and the ring finger. and I'm just going to keep tapping here. And as I tap on this point, I'm going to stare straight ahead, but I'm going to shut my eyes. Now I'm going to open my eyes and look hard and down to my left as I continue to tap, and hard down to my right as I continue to tap. Now I'm going to continue to tap and make clockwise rolls of my eyes, and I'm going to continue to tap that same spot, and I'm going to make counterclockwise rolls of my eyes. I'm going to continue to tap, and I'm going to hum the happy birthday song. And I'm going to continue to tap on that same point, and I'm going to count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And there you have it. That's emotional freedom technique. So we did not make specific statements or mantras as we were going through this. We were just simply reinforcing our own self-confidence by saying, I believe in me, as we tapped on the first set of points, and then we anchored it in by tapping on our it's called the gamut point, and we reinforce our right brain, left brain integration with music and with math, as well as targeted eye movements. So when we do this, we think about our own individual circumstances and what we're working on and what we want to improve and what physical problems we might have or what biopsychosocial problems we might have. And we use this as a tool. And I should tell you that Dr. Callahan was very successful at being able to get his post-traumatic stress disorder people to be able to make breakthroughs and reintegrate themselves into their communities. Now, we went through a lot. We did a little bit of all three of my workshops in one session. The most important things, I mean, when I go to continuing ed classes and I think about why would I take one class versus another, what am I going for? I want to go to a class where we meet all weekend and I learn something that I can use. And like I'm coming back to practice Monday morning, I want new tricks in my bag after this weekend class. So if I could point out the most important thing, the tricks that you should have in your bag after what we've talked about and we've done today, so critically important to take good care of your antenna, your body. Long in the torso, shoulders are back, head is up. I'm breathing in through my nose, I'm holding it, and I'm blowing out through my mouth. If you're incorporating that drill into your daily routine and taking 3 to 5 breaths, 5, 10, even 15 different times a day, after being exposed to this for the first time today, I couldn't ask for more. I couldn't be more pleased to have been able to come across and reach you in a positive way with this workshop. If you decide you want to come and work with me as a patient, and we have a rapport and we start making some progress together, and we think about what are the main exercises that I'm going to have you doing to reinforce, well, we already did them. Nothing supersedes having good posture and being able to breathe deeply when we talk about healing our own bodies. If you're thinking about what you can do for your workstation, how you can improve your work environment at home. I know we touched very briefly on that. We didn't go into near the detail we would if it were a 40-minute long presentation. But think about same posture that we talked about for the exercise. Put yourself in that posture at your desk. Don't let the light source glare off your monitor or hit you in your eyes. We talk about physical tools that you can use. I mean, we might be talking about a pain generator that comes from a neuro-emotional source, but there's still physical things that can be done to help you with this. So Phil, comments, questions, more outrageous, can't see from here? All right, so everybody who's listening in, thank you so much for your kind attention. I'm glad we got a chance to spend this time. We'll see how the patient schedule and patient flow works this week. I'm going to try and jump back in and be more present on somebody else's video to keep them company on screen. But if this is the only time we get to meet this week, I'm glad we had this. Thank you once again.